The electronic health record as seen on TV. Are you tired of paper cuts? Looking for orders that don't seem to be there? Labs, test results, missing forms from the chart? Are you tired of not having your documents in order? I'm trying to find these orders. There's got to be a better way. There's got to be a better way. Oh my gosh, this is just ridiculous. Out with the old, in with the new. Thanks to Obama and the ARRA, we introduced the electronic health record. Mr. Johnson, I'll be back to check on you in a little bit, okay? Wow, this is really great. Being able to do my charting on the computer. Electronic medical records has everything I need right here. I can look up my patient's notes from his ER visits, his previous surgery information. Everything I need is right here. I can even look up labs. I don't have to wait for them to call me anymore. This is really great. An electronic health record is a digital version of a patient's paper chart. Electronic health records are real-time, patient-centered records that make information available instantly and securely to authorized users. The electronic health record overall creates a broader view of a patient's care. The electronic health record allows the availability of information whenever and wherever it is needed. The electronic health records are designed to be patient-centered, evidence-based, prevention-oriented, and efficient. As Americans move towards improving national health, Medicare and Medicaid have designed incentive programs to help implement the use of the electronic health record. Quality improvement and safety in healthcare is in high demand. For patients, the electronic health record can provide information reminders such as appointments, e-prescriptions to save on wait times at the pharmacy, online interaction between patients and physicians, and even electronic referrals to enhance follow-up care. For providers, the electronic health record is used as a decision support tool. It also has reminders for medical information and is more legible than paper charts.
So the electronic health record came as a proposition to improve patient care and also to reduce the cost. It was first proposed by President George Bush in 2004, but it wasn't until 2009 when Obama passed the American Recovery and Reinvestment Act, when he proposed that all healthcare organizations adopted a EHR in their companies, in their organizations.
Now here's an example of an electronic medical record. So first here we have the patient's demographics, so name, birthday, ethnicity, and then also we have the patient's allergies, information about their primary doctors. So I'm going to expand this and gather some more information here. So see, we have vital signs. Let's see here. Vital signs, other medical problems and diagnoses, nutrition, urine output, the patient's sleep activities. Everything related to the patient is right here in the computer. And that's basically what the medical record is.
So what do you think are some of the advantages of having an electronic health record?
Well, for me, it helps me save time. I work in the pre-op department, and one of the
Mhm.
things we do is we call patients a few days before their surgery to get information and make sure they're safe for their procedure. So something that I like to do is I like to go into the patient's electronic record and get some information from their previous visits. So when they come through the ER, if they've actually had surgery at our hospital
Oh,
before,
okay.
I can see what kind of surgeries they've had. Because a lot of times patients don't remember, or they don't
That's
always
true.
know.
That's
So
very true.
I like to have that information ahead of time, and it just kind of guides my interview over the phone. So that's one way it helps me. It helps me save time, and I have some of the information right there at my fingertips.
Yes. For me, I work in hospice, so I can just have my little computer instead of carrying I see about 7 to 8 patients a day. So instead of carrying 7 big folders, I can just have my computer and access their information right there. And then since I go from place to place, as long as I have a Wi-Fi connection, I can see their their demographics, the notes from the previous week, their medication, if there has been any updates. So it's pretty nice to have that kind of tool for me to use.
It's also nice too because you don't have to deal with so much paper. You don't run the risk of losing
Exactly.
something. You know.
And I can just input my notes right away, or my like a summary of the notes of my visit.
It's nice.
All right. So overall, we think that the electronic health record has made a huge impact in increasing patient care. We have seen that in our everyday job. And if we take into account every hospital or every agency that uses an electronic health record, we can see that we're working towards making better, improving the patient care that we want. And we want to be advocates of the electronic health record so we can help other nurses that still afraid of it because maybe they are not too familiar with how to use the computer. So we want to advocate and say that it's for the good.
Yeah, it's for the good. I mean, all the hospitals and healthcare systems they're having to implement it.
Yes.
So everyone's going to have to know how to use it.
Mhm.
We're going to try to do away with paper charting and all of that in the future. So it's happening, so might as well get aboard.
So we're gonna show you a little scenario of how the electronic health record can be beneficial in the clinical setting. Hello, Mr. Pete. How are
the
you
doctor?
doing? No, I'm Nurse Florence. I'll be taking care of him.
Thank
How
God
are
you're
you?
here. He's burning up with fever.
Oh.
I'm Debbie, his girlfriend.
Hi, Debbie. I'm gonna ask you some questions.
Okay.
What is his date of birth?
I think it's March 14th or 15th. We just started dating, so we're still finding out that information.
Oh, okay. Did you know if he has any allergies to any medications or food?
I think he said he might be allergic to either peanuts or cashews. I can't really remember. It's some kind of tree nut. I'm not sure.
What about any medical history?
I don't know. I mean, we just started dating, so I'm really not too sure. He never said anything. He never mentioned anything.
Because I heard that he's just moved here from Florida, so we don't have any of his information. Do you happen to know who his primary physician was over there, or any information that can help us?
I do think I know his primary doctors. I think it's Dr. Swan.
Oh, okay.
Dr. Swan or Dr. Song.
All right. Okay. Well,
One of the two.
I'll be right back. Okay. I need
Okay.
to make sure I have the
Please hurry,
information
'cause
first.
he's been sick all night.
Oh, okay. It's okay.
As you can see in this scenario, the nurse was so busy getting the information, she forgot to assess the patient. Nurses are often focused on completing tasks that they forget that it's really all about the patient.
Oh,
Good
he's
morning.
sleeping. Hi, good morning.
Do you know what's going on?
Yes, that's actually what I'm here to talk to you about. I saw in his history that he's allergic to peanuts. So, did you know if he happened to eat something that had the nuts in it?
Well, I was baking yesterday. I had baked some cookies that had nuts in them, but not all of them had them. So maybe he accidentally ate a cookie with some nuts in it. I
Oh,
hope
okay.
not.
Well, thankfully we were able to access all of his information. I know that you guys just moved here, but we saw on the list of allergies that he was allergic to peanuts. So,
Well, I actually just got here, so how did you guys even get that information?
oh, well, our hospital has what we call an electronic health record, and with that, we can access information from our patients at any time, and we can see their history and any hospitalizations that they have, their previous labs results, and such information like that. Well, I'm glad to see that he's doing better and that you're here with him.
Oh, thank you.
I'll be around in the nurses, or just making rounds. If you have any questions, just you can call me anytime. Okay.
Thank you.
All right.
This scenario shows how the electronic health record can be a tool that nurses can use to gather information about a patient in situations where communication is limited.